And now get to reintroduce Dr. Razonable. If you remember, he talked to us earlier, and he really is an expert in transplant ID, so that fits right in with what we asked him to talk about. So, Raymund, thank you.
Good morning. So I was tasked to give the top papers in Transplant ID for the past year. And I have a few runners-up. If you get asked if an encephalitic donor can donate an organ, it's a big no, no, no. And again, it's showing in here, have you heard of a disease called Borna disease? I have not, but it's apparently a disease of horses, and they get it from exotic pet squirrels. And this turned out to be a donor-derived infection leading to fatal outcomes in transplant recipients. So, lesson, encephalitis in a donor, nothing for organ transplantation. I also bring this up as a runner-up because crossing boundaries, if you have a patient who wants to get transplanted and they wanted to go elsewhere for transplant, caution, because they may bring back multi-drug resistant organisms with them. There's an explosion of new therapies out there outside of infectious disease that affects us. This is your CAR T cells, which is basically chimeric antigen receptor-modified T cell immunotherapy. You have to know what it's targeting. This is an example wherein the target is the CD19 receptor of B cells. So if they use the CAR T for this, it wipes out the B cell population, so you have to be aware that the risk for infections is going to be high there. And there's a lot of inhibs coming out. Also, this is specifically a tyrosine kinase inhibitor. It affects B cells being used for lymphoid cancer. This is one of the largest reviews out there so far, suggesting that infections from invasive fungi as well as serious bacterial infections can happen in patients receiving ibrutinib, for example. Okay, so those are the runners-up, and let's go to the main top papers in Transplant ID. This is the classic histopath for cytomegalovirus. As you know, this is the prototypic opportunistic infection after stem cell as well as solid organ transplant recipient. It causes severe disease with fever and organ diseases. Patients really don't do well if they develop CMV. Their allograft function and survival is impaired. Despite being, there's been a lot of advances in its prevention and treatment, even in the current era,